Now I'm going to explain giving an IV medication, flushing the IV, and the use of a Carpuject. So using a Carpuject, I don't have one, so you remove it from the packaging, twist the blue lock to be unlocked, pull down the plunger, press the white part of the medication down till it clicks, put it in the Carpuject, lock the blue lock, screw the plunger down against the syringe of the drug. Then I can remove the cap and push the air out. Then it will be ready to give. To give an IV medication, first I would remove the cap and disinfect it from the connector. Then I would, I have a flush, so I would uncap my flush and hold the port, and I would want to get the air bubble out and connect the flush to one end of the end of the IV port. Then I would want to pull back and then press forward for pretty slowly over about a minute to make sure that the line is patent and that any residual medication has gone through. And then I also want to watch the IV site while I do this to make sure that it's not going below the skin or the line is where it's supposed to be. Then I can take this off. Then I'll scrub the hub again and apply my syringe, needleless or Lorlock, onto the end of the IV site again, onto the port. And then I can inject the medication at whatever rate it should be given. Also, then I'm observing the infusion site and observing the patient's reaction. If there's any adverse effects, I would stop and get the physician. Then I can remove the syringe from the port by twisting and scrub the port again. And then flush the medication through with a saline flush, as mentioned before, the same way. And then perform hand hygiene. I forget if I said I would perform hand hygiene in the beginning, but I would first start with performing hand hygiene, putting on gloves, and ending with that. So that was giving an IV medication, flushing the IV site, and use of a Carpuject.